Alright, so I've gathered all of my supplies and equipment that I will need. My name is Jamie. I will be your student nurse today. Can you please state your full name and date of birth?
Griffin Klein, May 1st, 1997.
Alright, and I verified that. I'm going to wash my hands, close the curtain for privacy. Are you in any pain at all today?
Nope.
Okay, great. Today we're going to do a head-to-toe assessment, starting at the head and working our way down. If you have any questions, just let me know.
Okay.
Do you need to use the restroom before we begin?
Nope.
Alright, so when I walked in, I assessed the patient's hygiene, body position, and nourishment, and they were all normal. Before I started the assessment, I took his vitals, and they were all within normal range. Blood pressure was 120/80, temperature was 98.6, the pulse was 75, and the oxygen was 98. And he said he was in 0 out of 10 pain. I'm going to assess the skin integrity throughout the whole assessment when I get to each body portion. So, can you please state your full name?
Griffin Klein.
Do you know what day it is?
April 22nd, 2019.
And what year it is?
2019.
And who the president is?
Donald Trump.
Alright, so he's oriented ×4. I'm going to start with the head by inspecting for symmetry, any gross anomalies. I'm going to check for infestation and infection, and then I'm going to palpate the sinuses. Is there any pain?
Nope.
Alright. So the head was symmetrical. I'm going to go ahead and start with the cranial nerves 1 and 2, which are our olfactory and optic. So I'm going to ask you to close your eyes and plug one nose, nostril, and inhale. What do you smell?
Black pepper.
Okay, and plug your other nostril. Inhale again. What do you smell?
Black pepper.
Alright, so his olfactory cranial nerve number 1 is intact. Now I'm going to move ahead to optic. I don't have the Snellen chart, so I'm going to stand 20 feet away. You can open your eyes again. Can you cover one eye and tell me how many fingers I'm holding up?
3.
Okay, and cover the other eye. And how many fingers am I holding up?
2.
Okay. And I don't have the Rosenbaum chart, but I'm going to hold this letter 14 inches from his face. Can you tell me what number that is?
3.
Okay, and cover one eye. What number that is?
7.
Cover the other eye. And what number that is?
8.
Alright. So cranial nerve number 2, which is optic, is intact as well. Now I'm going to do cranial nerves 3, 4, and 6, which is ocular motor, trochlear, and abducens. And I'm going to test these all together as well. You can focus behind me. Perfect. The pupils were equal around, reacted to light, and they accommodated each other. I'm going to ask you to keep your eyes on here without moving your head. Okay, perfect. Cranial nerves 3, 4, and 6 are intact, which was ocular motor, trochlear, and abducens. Now I'm going to move on to cranial nerves 5, 7, 8, and 11. 5 is trigeminal, so I'm going to go ahead and do that. Can you clench, open, keep your eyes closed? Where am I touching?
Forehead.
And where?
Cheeks.
Alright, so cranial nerve 5 is intact, which was trigeminal. Cranial nerve number 7 is facial. I ask you to smile, frown, puff your cheeks out, raise your eyebrows, close your eyes. Cranial nerve number 7, which is facial, is intact. Cranial nerve number 8 is acoustic. I don't have the Weber or the Rhine test, so I'm just going to do the whisper test.
Watermelon.
And I'm standing behind him, so he can't read my lips.
Pineapple.
So his acoustic cranial nerve number 8 is intact as well. And now I'm going to do spinal accessory, which is cranial nerve number 11. I'm going to ask you to shrug your shoulders, look left, and look right. Perfect. Cranial nerve number 11 is intact as well. Now moving on to 9, 10, and 12, 9 being glossopharyngeal, 10 being vagus, and 12 being hypoglossal. I'm going to test all of these together as well. Can you go ahead and swallow? Alright, stick your tongue out. Stick it side to side, up and down. I'm going to test the strength with the tongue depressor. Alright, and now while I have his mouth open, I'm going to just inspect the oral cavity real quick. Say ah. So 9, 10, and 12 were all intact, which was hypoglossal vagus and glossopharyngeal. And so I had his mouth open and inspected the oral cavity while I was in there, and the uvula was midline and there was no gross anomalies inside the mouth. So now I'm going to move down to the neck and inspect the neck. The trachea is midline, and now I'm going to palpate the lymph nodes, starting in front of the ear, under the jawline, down the neck, in occipital, and above the clavicle. So everything was normal there. Now I'm going to go ahead and palpate and auscultate the carotid arteries. I'm going to auscultate first. When I put I'm going to use the bell side. I'm going to put the bell to you and ask you to hold your breath. Okay, and again. Okay, perfect. And now I'm going to palpate one at a time. Okay, good. Okay, perfect. Now I'm going to move down to the upper extremities. Hold out your arms. I'm assessing the skin integrity. They are both pink. They are dry and they are warm bilaterally. I'm going to look at the nail angle, which is convex, and I'm going to test for capillary refill, making sure that it's under 3 seconds, which it is. Now I'm going to check the pulses one at a time on the radial pulse. Strong. And they are both +2 bilaterally. Now we're going to do some range of motion. I'm going to ask you to flex your elbows, and I'm going to pull against them. Now I'm going to push. So that was strong. That was about a 5 out of 5 motor strength. And then if you can raise your arms above you, and then you're going to abduct and adduct. Stick your arms out, flex your elbows and extend. Flex your wrists, extend your wrist, and hyperextend. Great. And if you can grip my hands and squeeze as tight as you can. Perfect. That's about a 5 out of 5 as well. So I'm going to go ahead and move on to the thorax and cardiac assessment. I'm going to assess for symmetry, and I'm going to check for any gross anomalies or anything like that. Alright. And then while I'm doing that, I'm going to check the skin turgor for tenting, which is a sign of dehydration, which his is great and intact. Now I'm going to go ahead and listen to the heart sounds. For the sake of the video, I'm not going to sit at each one for a long period of time. I'm going to start with the diaphragm. The apical is the second intercostal space on the right. Moving to the pulmonic, the second intercostal space on the left. Down to Erb's point, the third intercostal space on the left. Down to tricuspid, the fourth intercostal space on the left. And the mitral valve, which is the fifth intercostal space on the left. And when I'm at the mitral valve, I would check the apical pulse for a full minute. But for the video, I'm just going to do it briefly. Okay, and that's a +2. Now I'm going to go ahead and move on to the lung sounds. There is 12 sounds on the anterior side, and I'm not going to sit at each one for too long for the video. For the heart sounds, I would have gone back and listened with the bell as well, but to save time, I'm just going to go ahead and move on. Starting, I would listen above the clavicle, which are not counted, and then I would start with number 1 being here, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. So I'm avoiding the sternum and I'm getting the sides. And then I'm going to go ahead and check the 16 sounds on the posterior side as well. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. And I avoided the scapula on the posterior side. So now I'm going to ask you to come please sit on the bed. And lay down please. I'm inspecting the abdomen. There is no protrusions. It is flat and I can see the pulses. So I'm going to go ahead and auscultate first. I would auscultate in each quadrant for 1 minute. Minimum of 1 minute, but for the time of the video I'm just going to do them quickly. Starting in the right lower quadrant, going up to the right upper quadrant, over to the left upper quadrant, and down to the left lower quadrant. Bowel sounds are present and normal. I'm going to go ahead and percuss them now in each quadrant. Okay, and then I'm going to go into palpation. I will stay away from the deep palpation. Are you in any pain?
Nope.
Alright, so there's no growths or lumps and the client is not in any pain. Alright, you can go ahead and sit up. For the sake of the video, I'm not going to assess his genitalia, but if I were to, I would do it. First I would check the femoral pulse, which is on the inner thigh. And then I would state that there was no abnormalities, there was no tubes, odors, or discharges present, and everything was normal. Now I'm going to go ahead and move on to the lower extremities. Once again, I'm assessing both legs for the color, correct for ethnicity. They're both pink, they're both dry and warm. I'm going to start by taking his peripheral pulses, starting on his dorsal pedis for each side, one at a time. Then moving on to his posterior tibial. And now his popliteal. Perfect. All 3 of those pulses were +2 bilaterally as well. Now we're going to do some range of motion exercises with the legs. You can go ahead and extend the knees and flex the knees. Okay, and then I'm going to have you straighten your legs and push towards you and push towards me. Strength is about 5 out of 5. And then we're going to have you flex your ankles this way and extend. Perfect. And if you could stand up, I'm going to have you copy me. Flex your hip and bring it out to the side. Perfect. And back. And then you're going to abduct and adduct your legs, so bring it out and back in. And if you can back up so the camera can see you, do the external rotate and the internal rotate. Okay, and the eversion and the inversion. Perfect. Now I'm going to have you walk across the room and back. Then I'm going to have the patient stand for 20 seconds with his eyes closed. This is the Romberg test, and it's testing for balance and making sure that he's not swaying. And I'm going to hold on to him for safety. Alright, that's good. You can have a seat. So I have finished the head to toe assessment. Now I'm going to go ahead and document into my client's chart.